Kuda nani anaitwa aje? Good evening.
Good evening, Katile.
I won't make you have the session live in Facebook, but I'll share the recordings in YouTube. So I think it's time, and we are quorum. We can start off the session. And for those who are asking about the attendance form, I will send before 6. Check in the chat box. And if you will experience problems, then I'll say I will consider that in your attendance form. So today we are having our session 22 on building a healthy mother and child, which is our 22nd session out of the 28 sessions that we should have. And today we'll be having our speaker, Dr.Joyce Jebet, who is a midwife at University of Nairobi. And the topic that's taking us through is Introduction to Maternal Mental Health Care and Reaching Out to Support. I'm sure we are much interested into knowing about maternal health, and will take us through the introduction into healthcare. So welcome everyone, and thank you for joining on time. So welcome our speaker.
Thank you very much, Katile, for the introduction. My name is Joyce Jebet, and I'm happy to be here. This is a very good initiative, and we'll be talking about maternal mental health. And allow me to share my screen. Okay, so what we are talking about today is an introduction to maternal mental health and reaching out for support on maternal mental health issues. And we'll begin by this phrase, recognition of maternal mental health has not been a priority on health agendas for many low and middle income countries. And that will attest, most of the time, if you listen to people talking, most of what they talk about could be other issues, not necessarily maternal mental health. And even if it's maternal health issues, then the issues may not necessarily be on mental health. So most of the time, the mental health aspects are silent when we talk about or when people are prioritizing their health agendas. And this is a very, very important area because many women suffer in silence if this issue is not addressed. So the burden of maternal mental health, because of the issue that this may not be something that comes to the limelight every other time, remains silent and hidden. And this affects the health of the women and children, especially in our low and middle income countries, despite the higher prevalence that these issues have. So mental health disorders, most of the time, are underdetected, they are undiagnosed, or even if they are diagnosed, sometimes they are undertreated, especially during perinatal care, because the assumption is every pregnancy is supposed to be a normal physiological event. So most of the time, if someone goes through a mental issue when they are pregnant, it may go undetected. And also, this may become afflicted by the changes that happen during pregnancy that affect the woman physiologically or even psychologically. So that's why it may go undetected or undertreated. So this could result to serious consequences that not only affect the baby, but also affect the woman later in life. The unfortunate bit is we have very limited information about maternal health conditions, again, in the low and middle income countries, because maybe we have challenges in access of data, we have challenges in reporting, we have challenges in getting information. So if you look around, there is very little information, particularly relating to maternal mental health. Another issue is we do not have a lot of cultural and socially accustomed researchers. So we know we come from different cultures, we come from different social backgrounds, and these tend to also affect how we report or how we we look at mental health aspects. So if we have researchers around this area, then we can be able to bring in interventions that can suit, that can be culturally and socially acceptable, and therefore be able to address at the end of the day. So the question we ask ourselves is, what is maternal health? So it's good for us to understand what maternal health is before now we talk about what maternal illness or what maternal mental health is. So when we talk about maternal health, we are referring to the health of a woman during pregnancy, during labor and childbirth, and during the postnatal period. So all the issues that affect the women during the pregnancy, labor, and childbirth that are geared towards a healthy status is what we refer to as maternal health. So we are just concentrating on pregnancy, labor, and childbirth, and also the postnatal period. So this maternal health, it's not only the physical health, but it also encompasses the mental health. We have the emotional health, and we also have the social health of these women. So basically, it is the holistic care of the holistic health status of the woman. And the aim of having maternal health is to be able to optimize the health of the woman and her baby. Because when a woman is pregnant or when they're in the postnatal period, they're not only taking care of themselves, but they're also taking care of the baby by providing nutrients and even psychologically, emotionally for that baby. That aspect is very, very important. So there are many factors that contribute to maternal ill health now that we understand that the health of the woman during pregnancy, labor, and childbirth is very important. So there are factors that would contribute, and we'll be looking at this, and particularly we'll be concentrating on those that contribute to maternal mental health. So then now we move to maternal mental health. So what is maternal mental health? Mental health in itself refers to a person's emotional wellness and their ability to enjoy life. So it's more of the emotional aspects. It's more than the absence of mental illness. So when we talk about mental health, it's not just because someone is psychotic, someone is mad, but it's more than that. Is this person having emotional health? Because sometimes you may have someone who has emotional instability. They may not be found in a hospital, but they are not necessarily admitted in a hospital for treatment, but they are emotionally unstable or they are mentally ill. So when we talk about mental health, we are referring to the entire wellness of a person's emotions. And it refers to a person having a sense of purpose and a sense of connectedness to others. They can be able to interact with other people. They can be able to have a positive outlook of life. And that would now bring in the mental health if we refer to this individual as a person who is mentally healthy. So maternal mental illness is the illness that occurs during pregnancy, during the period of labor and childbirth, and also up to 1 year after childbirth. And why this is important for us to understand this definition is because, as we have said, during pregnancy and during childbirth, these are critical times where sometimes the woman may undergo a mental illness and they may suffer later. And this may go on even beyond the 1 year that we have mentioned under this definition. So mental illness is a psychological or emotional condition. And as a result of that, the person is not able to function normally. And this functionality is not only for a short period of time, but it goes on over a period of time. It can affect a person's thoughts, how they think, their emotions, their behaviors. So generally how this person functions, this mental illness will definitely affect how they work. And when we look at mental illness, there are different types of mental illnesses, particularly those that surround the health of a woman who is pregnant or who is in the postpartum period. What we need to be happy about is mental illness can be diagnosed. It's possible to do a diagnosis of mental illness, and it's possible to actually recognize and be able to manage persons suffering from mental health. So we'll still mention just a mention of mental illnesses. I hope my colleague who is a mental health expert has been able to join. So she's more experienced when we talk about mental illnesses. So emotional problems, as from our definition earlier on, we mentioned that when a person is mentally ill, then they have emotional disturbances. So emotional problems may be overshoot, that are overshoot duration may not necessarily interfere with the person's daily activities, although if they last long, then they become a mental illness. If a person, maybe they got some information and they are not happy about, they cry for 1 hour, they're emotionally unstable for 1 hour, then that is not mental illness. But if this is prolonged and the person is entirely affected, they are not able to function, then that now will be classified as mental illness. A person may have distressing thoughts, they may have distressing emotions or even behaviors that now over a period of time, they affect their functionality. And now that is where now we talk about the mental disorders. So why are we interested, or why are we so much concerned about maternal mental health? As you remember from our definition, we said maternal mental health is the mental health of a woman that is pregnant or during the period of postpartum. So why are we concerned? And the first reason is because during this perinatal, we call this the perinatal period. That is the period from pregnancy, during labor and childbirth, and the period after birth of the baby. That is the postpartum period. So during this period, whatever affects this woman during this period is likely to affect the infant, and it may bring a change, a phenomenal developmental change to both the woman and her baby. Another reason why we are concerned about this is that depression, which is a major mental illness, is the second leading cause of disability among women of reproductive age. It's the second leading cause of morbidity, if globally that is. So if you are able to pick it out early as possible, then we can be able to prevent some of these disabilities that may affect the women of reproductive age. Another reason why we are concerned, if we look at this diagram, look at this woman who is pregnant. So it follows two pathways. So we have a woman who is pregnant. They have minimal maternal adversity. As a result, so they are able to have good bonding with their babies. This leads to a healthy baby. Now that the baby is detached, this woman has given birth. So the baby is healthy, they have good cognitive development, and they do not have behavioral or psychological problems in their childhood. In their adulthood, they have a healthy adulthood, so they are devoid of illnesses or diseases. If we look at a woman who is pregnant, who is exposed, they have maternal adversity, they have anxiety, they have depression during pregnancy. So this woman may have postpartum depression, a condition that affects the woman after birth, or they may have poor maternal bonding. So the mother and the baby are not able to bond very well. As a result, this now affects the child. Remember, we said we are concerned about maternal mental health because it is not only the mental health of the woman, but it's also the mental health of both the mother and her baby. So during childhood, this woman who had adversities during pregnancy, during the postpartum period, the children are likely to have impaired cognitive development because the bonding is impaired. So there is very minimal interaction of the mother and the baby. And therefore, this baby is likely to have behavioral or psychological problems. And this in their adulthood, they are likely to be predisposed to adult psychiatric illness. So in their adulthood, they may develop a mental illness. They may have other medical illnesses like hypertension and diabetes as a result of the poor cognition development. You may want to ask why these illnesses. Generally, it's because of the impairment of the hormonal and so on imbalances and the genetics that this woman who has a mental illness has transferred to this baby. So this woman, if because they have not received adequate support, then they predispose their child to having adult mental illness because they themselves suffer. And what you will notice is sometimes if this woman who is pregnant, who is exposed to anxiety and depression receives good support, then she's likely to move from this lower path and joins this upper path, and she will have good maternal bonding and eventually have a healthy baby. Again, the woman who has minimal maternal adversity, they are likely to also follow this other path and come into this. For the baby, if care is taken during this period, during the postpartum period, interventions are put in place, we can be able to move this baby from this to the path that they can have a healthy lifestyle. So the prevalence of maternal mental illness, as I mentioned earlier, there is a bit of challenge in getting the actual statistics particularly in our country. But the general information is that psychosis, which is a major mental illness, affects 1 in 2 women for every 1,000 births. This was from a USA study. And as a result, this may predispose the women to have tendencies of suicide, or sometimes they may even cause harm to the baby. The prevalence of depression, again, a study by Tomlinson in 2020, last year, they found that the prevalence of postnatal depression is very high in poor resource settings, which our country is one of them. A study done in Ethiopia this year, this was published this year, it was found that common mental health disorders, that is anxiety, depression, are very prevalent among mothers with children who are aged below 5 years. That is about 36.6%. That's very, very high. And psychosis, which occurs 2 out of every 1,000, is marked with hallucinations and delusions. Again, these are serious mental health disorders. And it's not only the women who suffer, but we also have the fathers suffering, particularly for depression during the postpartum period. And it is estimated that 1 in every 10 new fathers, those who are fathers for the first time, they're likely to experience depression during the postpartum period. That is if they have risk factors and interventions have not been put in place to address the issue. So this is just to give a picture of how maternal health is presenting in the middle income countries. So during the antepartum period, we have 1 in 4 of antepartum women experiencing depression. Again, that is not a small number. 1 in 5 of women experience postpartum depression. Again, that is a big number for us to think about. A study by Ongeri in 2018, that is now in Kenya, they followed up 171 women, and they were following up from these women from the time they were pregnant all the way to the time that they were in the postpartum period, that is the first 6 to 10 weeks. So they were followed up, and they realized that out of the 171 women, those who developed postpartum depression were 18.7%. Again, that is a high number. And another study which was done in Mombasa, which was looking at the common mental disorders, as we mentioned, depression and anxiety. It found that they were the women who suffered were estimated at 20% from their study sample size. So that tells us this mental health issue that is affecting women of reproductive age, particularly women who are in the peripartum period, is high in our country. If we take the average, that comes to around 19% from these 2 studies. So it is an issue that we need to address. It is an issue that we need to be concerned about. And it's an issue that we need to take it up and put in interventions that can be able to manage the women. So let's look at some of the risk factors for maternal mental illness. One of the risk factors is poverty. It has been found that women who live in poverty, they are subjected to stresses of unemployment. Maybe they have poor housing, they have food insecurity. So this predisposes them to stress, and this eventually, if not handled early, then these women may be predisposed to depression. Another issue, another risk factor is rape, violence, and abuse. So women who are at risk of domestic violence, which we know gender-based violence is an issue that is of great concern in our country today. So if we have these women who have constantly been exposed to rape, they have been exposed to violence or abuse, these women are likely to be predisposed to mental illness, particularly during this time that they're pregnant or they're during the postpartum period. Why? Because pregnancy in itself comes with a lot of issues, physiological changes that the woman is experiencing. Or sometimes during the postpartum, this woman has a baby who is crying the whole night sometimes. Maybe they don't even have enough food to feed this baby. So there are other issues that are likely to bring stress to this woman. And adding on top of that, rape, violence, and abuse, it makes it worse and is likely to predispose the woman to having mental illness. HIV AIDS, this is a pre-existing condition that women may have during pregnancy. And the unfortunate bit is that most of the women learn of the HIV status during pregnancy. And the reason why is because during ANC profile, or when the women come for ANC or antenatal clinic, one of the things that needs to be done as they check their status is HIV test. So sometimes some of them may not know that they are HIV positive. So at the time that they learn about this is very, very distressing, and some of them go into depression. Adolescents, particularly here, we are talking about adolescent pregnancy, and an adolescent by WHO definition is a person aged 10 to 19 years. So the adolescents, the fact that this is a phase that involves a lot of physical, emotional, psychological, social development, there are a lot of changes that happen in the body of this individual. And to add to that, if they become pregnant, then they are likely to be twice at risk of developing depression compared to the non-pregnant adults. And the reason for this is at this point, most of these adolescents are not dependent. Most of them are still dependent. They are not independent. So they are pregnant. Most of them could be in school, so they are not able to manage that pregnancy. Maybe they're not sure what to do. The parents may be having issues with the pregnancy. The person who made them pregnant, maybe they have disappeared. So there are many issues that come around, particularly for the pregnant teenagers, as compared to the adult, pregnant adults. So they are twice at risk of depression compared to the pregnant adults. Still on the risk factors, having an unsupportive partner or having no partner, single motherhood or unsupportive partner is very emotionally distressing. And again, the issue of support comes in two ways. We could have talking about the physical, emotional support, or even the financial support. So if this is lacking, it is distressing. And the woman may be predisposed to maternal mental health, particularly here, mostly is depression. And it's not only the partner that we are talking about in terms of providing support, but we also have the family and friends. So if they do not offer support, again, the period of pregnancy comes with a lot of changes. Maybe someone had a certain lifestyle. They need to change into a certain lifestyle. This doesn't become very easy for them. And that lack of support, the time that they're going through this pregnancy, maybe they have even complications of pregnancy, they're not receiving support, so that predisposes them. An unintended pregnancy. It is estimated that 50% of the pregnancies are actually unintended. They're unplanned. So when a woman has an intended pregnancy, maybe this is a woman who gave birth the last 6 months, she's been breastfeeding, and now she realizes that she's pregnant. It's very distressing. And that distress of having a pregnancy that is not planned is likely to predispose them to mental illness. And this is in comparison to those who had a planned pregnancy and those who had an unplanned pregnancy. The risk factors are many. So a previous history of mental illness is also a risk factor that can predispose the women to having mental illness. So previous history is likely to, the triggers that made the woman to have this mental illness the first time are likely to also precipitate during the period of pregnancy or even during the period of postpartum. Pregnancy loss, we have witnessed sometimes women who have had several losses. Maybe someone has tried to be pregnant, they get pregnant, within 2 months, they get an abortion or a miscarriage. They try again, they get another miscarriage. So that becomes a distressing factor. So if the first miscarriage was not addressed, then they continue having subsequent, then it is likely to make them predisposed to mental illness. Other obstetric complications, when we talk about obstetric, we are referring to the period during pregnancy, labor, and childbirth. So if a woman has complications during this period, they may contribute to mental illness, particularly women who have complicated labor process. Sometimes some women have a very difficult labor. Some women have a very prolonged labor. Some women have a very painful labor. So those complications that happen around that time, they are likely to be predisposing factors to maternal mental health. Other factors could include forced migration or a refugee status. Let's think about the time that we had IDPs in our country. These women, maybe there were women who were pregnant. There were women who were nursing their babies, or they were breastfeeding, and now they have been forced out of their homes. They don't know what to do. They don't know where to sleep. They don't know what to eat. So it becomes a challenge, and this is, it becomes post-traumatic stress. It causes a stress disorder that we call it post-traumatic. They are under a lot of trauma, and as a result of this, then they are predisposed to mental illness. Alcohol and drug misuse. So alcohol, drug abuse, all this affect the woman's mental ability, leads to poor judgment, and this leads to devastating effects for both the mother and her baby. A major life event, like maybe in the past year, the woman has experienced serious issues. We know we have been talking a lot about COVID and the way how COVID has affected people, particularly in the last a few months ago. You may have had situations where in a family, they have had more than 2 deaths that are following each other. So that is very traumatic, and it's very a tough time. And if a woman experiences this, they are pregnant or they are they are in the postpartum period, then they are likely to be predisposed to mental illness. So those are the risk factors, and you can see that list may even be endless. There are quite many risk factors that may predispose a woman to having mental illness. Broadly, we can categorize the causes. If you go to the specific mental health diseases, you may not find the actual cause. Most of them, the cause is unknown, but there are factors that are linked to the illness. So broadly, we can categorize this into two. We have the physical causes and we have the psychological causes, which actually the psychosocial causes are many. They're even more than possibly the physical causes that we could mention. And physical causes are mostly related to the disease or maybe an illness, a pre-existing illness that the person may be having. Like in this case, a few examples, a chronic infection, like maybe cancer, anemia, thyroid deficiency. So this affects the metabolic function. and the HIV infection. And then the psychosocial issues, as I've said, actually from what we have listed, most of them come under the psychosocial issues, and most of these would range around the friends, family, and community support, and how a person is able to cope with the distressing state. So we look at the types of maternal health, just concentrating on the maternal mental illness. And broadly, we have three mental health issues that affect women. We have maternal blues, we have puerperal psychosis, and postpartum depression. So maternal blues, which is commonly referred to as baby blues, this is a temporary psychological state. And it occurs in about 80% of all postpartum women. So some books would even tell you between 80 and 90%. So almost all women who have given birth are likely to suffer postpartum blues. And the reason why they suffer is because of the hormone fluctuation. During pregnancy, there is high levels of particularly progesterone and estrogen hormones. And towards time, as the woman is going to the end of the pregnancy, then these hormone levels, now we have other hormones that would help in assisting the baby to get milk, breast milk. So we have oxytocin and prolactin hormones at the time that the woman is giving birth. Oxytocin, of course, is a hormone that plays two roles. It helps in contraction of the uterus, so it brings about uterine contractions, and that's how the woman will go into labor. And then we have the prolactin hormone, which is key in milk production. So we have very high levels of estrogen and progesterone during pregnancy. Then as soon as this woman gives birth, then those hormone levels will go low. So that fluctuation tends to destabilize the emotional stability of the woman. And this predisposes them into that psychological state where they may be ambivalent. They may have a mixture of feelings. Sometimes they're very sad. This minute they're very happy. This minute they're crying. Some would feel just unhappy for no apparent reason. They may be very impatient. You want to do something for them, but they quickly change their mind. Or sometimes they're irritable, they're restless, they're anxious, they feel lonely, they feel sad, they feel maybe sometimes they even feel no one is there to help them, and so on and so forth. So the beauty is that these symptoms do not last more than 2 weeks. And most of the time, they do not require any intervention. All that needs to be done is support, that supportive care from the family and friends. It's very, very helpful for this client. Depression, postpartum depression. Depression is classified as a major psychiatric illness or a major mental illness. So maternal depression or postpartum depression is characterized by low mood. So generally now, from what we mentioned as postpartum blues, because they're temporary, this person is likely to exhibit similar symptoms. Although now, in this case, these are symptoms that are prolonged. They last for a long time, between 2 to 4 weeks. The person feels hopeless, they feel they do not have energy, they lose interest in doing anything, they are moodless, and this makes them just to be so detached from people. So they lack a social aspect. And as a result of this now, some of what needs to be picked up and be diagnosed so that this does not continue and affect the woman and also affect her baby. We also have anxiety disorders. If you remember, we mentioned that we have a category of common mental health disorders. So we have depression and anxiety as under the category of common mental health disorders. So anxiety disorders during pregnancy and during the postpartum period. The woman may have a sense of uneasiness, they may feel worried, or they have some fear. And another aspect of anxiety could come in through some phobias. And the fear that we have picked here is a fear of childbirth. Why women would fear childbirth is because of the rumors or the myths that they have been told about pregnancy. or even labor. So sometimes women may come to the facility, and if you listen to them, some tell you they're expecting more pain because they're told this is pain that can crack your head. Sometimes some of what women tell you is really a lot of myths, a lot of misconceptions. And for some women, because of those issues, this may predispose them into this condition that we call phobia, which is abnormal and persistent fear of childbirth. This may also result from previous traumatic birth experiences. So maybe during their first pregnancy, they had a very difficult labor. Some women do experience. Maybe they were sexually abused or raped so that they get for that pregnancy that they are carrying is a result of rape and sexual abuse. So this is likely to predispose them to this condition, which would be part of the anxiety disorders, and if not well handled, they may lead to major mental illnesses. Other conditions that may affect mothers during pregnancy is we have post-traumatic stress. I know somehow we have mentioned this. So a woman who has had a traumatic event, maybe they were sexually abused, the person, their partner died, they were involved in an accident, or they had a natural disaster like floods, or maybe fire broke out. So it becomes a very traumatic issue, and it may predispose some women to post-traumatic stress disorder, particularly if this issue was not addressed, or during the time that they were experiencing this, they were not taken through a session of counseling, or they did not receive adequate support. So if they had a traumatic event, then they are now pregnant, it may be associated with a serious or a serious outcome of this pregnancy. It is estimated that 9% of women experience post-traumatic stress disorder. And some of the reason why some women may have this is because of a difficult or a complicated birth, or a difficult pregnancy, a complicated pregnancy. Maybe someone was hospitalized for so long during the period that they were pregnant. And sometimes this could also lead to further hospitalization at the time that they have given birth. So the other major illness is postpartum psychosis, and it is a major or a common disorder in the postpartum period. And again, this is a serious illness, so it needs close attention. So women may be predisposed to this. Some of them may be as a result of their previous illness. Maybe someone is already mentally ill, they have a bipolar disorder. They may be alcohol or substance abusers, so they have alcohol or substance disorders. So this can lead to serious psychotic symptoms that, if it is not treated, then it leads to dysfunction of this individual. I got this example from a slide on the internet, and it's a very good example of how women can go on with their lives, and sometimes they have a mental illness that is undiagnosed. Let me just read this story. Within 24 hours of giving birth to my daughter Marilla in 2007, I was hypomanic. I became excessively talkative, energetic, and elated. My episode was undetected by hospital staff because it was perceived as a mother's joy of having a healthy newborn. When I returned home from the maternity hospital, I also had hypergraphia, a rare compulsion to write. I wrote hundreds of pages while I breastfed my baby. I typed so much so that I could barely move my writing arm, and I had muscle spasms in my back and neck. As the weeks passed by, Marilla didn't gain weight because I was writing too much instead of breastfeeding her sufficiently. My manic symptoms were mistaken for mother's joy. I needed help. So this is the person who wrote this information. So this tells us that sometimes, as we mentioned, if you remember when we started, we said women can actually have mental illness, which goes undetected or it goes unnoticed because it camouflages with how maybe a woman who has just given birth would present. And if, as healthcare workers, become keen to be able to diagnose, we can be able to pick out some of these issues, because a woman was just given birth and they're busy writing, that should raise an alarm. That's a red flag that possibly something is not working well. So diagnosing mental health, there are many, many ways of diagnosing, but the most important is that there are tools that exist that can be used to screen. And if you look at, I've just put in some 4 tools that could be used. I know the common one is the Edinburgh. Possibly if you are a medical, you may have come through this tool for diagnosing mental illness. So when we talk about screening, these tools, some have like 7 to 10 questions and so on. So they have specific questions that you ask the woman, and from the question, the answer that you get will help you pick out whether this woman has a mental illness or not. So this is a very important way of picking out whether the mother has a maternal mental illness. Using the screening tools. I know maybe in our setups, this is not so much adopted during the postpartum period, particularly because it would be the best time to pick out if the woman has a mental illness. And not only to say that, also during the antenatal period, this can be used to be able to pick out. So these tools exist, some during the postpartum period or during the period when the woman is pregnant. And they're very, very helpful in, because if you look at the questions that are asked here, they are simple questions like, I have not been able to join my friends for something. I have not been able to socialize, something like that. So you can be able to pick out from these and add up. So you get a score, and from that score, then you can be able to grade whether the person has a mental illness or not. So that's about the diagnosis. It's also good to mention COVID-19 because definitely we cannot run away from COVID. It is the period that we are living in the times of COVID. And one thing to note is that pregnant women and postnatal women, during this period of COVID, the issues of social distancing, social isolation, leads to limited social support. This predisposes the women into mental health. So we should not remain silent, because this COVID in a way has also contributed to maternal mental health. And particularly, we know so many people, especially last year when there were lockdowns, the curfews, a lot of people lost their jobs, a lot of people were economically destabilized. So COVID has come with a lot of issues that relate to maternal mental health. Now, we move to the effects of maternal mental health. And when we look at this, the common perinatal disorders, we have mentioned depression, anxiety, and somatic disorders where psychosis is part of it. These conditions generally affect the quality of life for both the mother and the baby. And if you remember the chart that we had earlier, where if a woman is pregnant, they have good support, although they are predisposed, they may be able to move on, and eventually also their children will have good quality life. So these conditions affect the quality of life for both the mother and the baby. Something to note, alcohol use and if a person was already predisposed to mental illness, psychosis, these are very, very big contributors of pregnancy-related morbidity and mortality, particularly in mental health. So mortality would come in maybe because of the issues of suicide. And not effects of fetal exposure to maternal anxiety would last in adulthood, as we saw earlier. So if this fetus is not receiving the warmth, the joy of the woman when she's pregnant, then this is likely to expose this baby into having a maternal anxiety and depression, or having anxiety and depression, or having a mental illness later in life, as we saw. Just concentrating on the pregnancy itself and maybe the issues of the baby after they are born. So when a woman is pregnant, they have a mental illness. This leads to poor fetal growth. So when the fetus is in utero, they may have a poor growth, and poor growth in this case, so they have what we call intrauterine growth restriction. They are not able to grow normally. So let's say a baby born at term, on average, they weigh between 2.5 to 3.5 kilograms. But now this baby is born at term, but they are weighing maybe around 2 kilograms. So that is a baby who has a low birth weight. Low birth weight. They have a weight below 2.5 grams to 2.5 kilograms, and yet they are born at term. Term means they have completed 37 weeks gestation, or they have a small, very, very small weight because of the growth restriction. They were not able to grow normally. And some of the reasons why the babies may not be able to grow normally is when this woman is distressed during pregnancy, she's not able to eat adequately. That means this baby is not able to get well nourished during pregnancy. And that leads to that poor fetal growth or the low birth weight or intrauterine growth restriction. Another effect of maternal illness during pregnancy is preterm birth. Women may be predisposed to having preterm birth, and the triggers could be because of the hormonal issues, and also we have mentioned the low birth weight. As a result of that preterm so this baby is born before that 7 completed weeks. And definitely, if that baby is born before that 7 weeks, they are likely to have a small weight. And we know the issues that come around when a baby is born prematurely. They may be admitted in the nursery. They may be they may be predisposed to other illnesses that come as a result of prematurity. So when these children who are born to mothers who are predisposed to maternal illness during pregnancy are born, these children are more vulnerable to infection compared to their counterparts whose mothers were not exposed to mental illness. And some of the conditions that have been from a study that was done, the children whose mothers had mental illness during pregnancy were found that they are predisposed to attention deficit disorders. They may also be predisposed to developmental, cognitive, or language delays. So they are not able to move fast. They have delayed milestones. These children later in life, as we saw, they may also be predisposed to mental illness, issues of anxiety, issues of depression, behavioral, or even emotional problems. And that means this child is likely to frequent the hospital, and most of the time they may need to be admitted. So maternal illness during pregnancy can negatively affect the baby and even the child in their childhood. For the children, mental health affects the children because this is likely to lead to social problems, as we have seen, poor performance at school because of poor cognitive development. And as we mentioned, they may develop mental illness themselves if they do not receive support. Again, the good thing is if interventions are put in place before this child develops the mental illness, then this child is likely to move into the path that they are going to grow normally, or they are going to have a healthy life. It also has effect on the family and the society. So the parents, where we have a mental illness, the parents emotionally, socially, and even cognitive-wise, this affects the development of the children. So this can also have a negative impact on the educational and economic potential of the children because the parents have had or they have been predisposed, particularly the mother has been predisposed to a mental illness. So this will have a negative effect on the development or on the growth of the children. So then when we talk about maternal mental health, what we need to know is there are many aspects that have come in place to be able to offer support. we are all aware of the existence of Maternal Mental Health Awareness Week. And this is raised because of what we mentioned earlier. Sometimes as a result of cultural, social, and so on, people may not take mental health as something that is serious. Sometimes people would even say that this person is pretending. So bringing in a health awareness week, just to be able to talk about maternal mental health, is very, very important. Support also comes in various organizations have been developed, collaborative approaches, that is having team players from various persons. We have non-governmental organizations, we have the government, we have individual, we have private companies, and so on. So that collaborative approach to be able to offer maternal mental health is key. Let me give an example of, say, for example, Nairobi Women's Hospital. And because of issues of gender-based violence, they offer very big support to persons who have been violated, maybe sexually and so on. So that is just an example of how an organization can be able to offer support. And as a result, they are offering mental health support. It's also important to support both fathers and mothers. As we mentioned, both the fathers and mothers are predisposed to mental illness. And another very, very important way of offering support for mental health support is a community approach. And if the community is having an understanding, or if the community is able to have an understanding, community is able to accept, or they're able to integrate with persons who have mental illness, then this can go a long way in preventing serious mental health issues. And one way that can be used in maybe reaching into the community is home visiting. One time we had a patient that was mentally ill, and we took that patient to their home. And when reaching their home, actually the family did not want that patient there was total acceptance of the patient. And that if this person, if the family had been given information about how to manage a mental health person, then that stigma would not be there. So going to the point of home visiting, or even creating community awareness to destigmatize mental illness, can be able to break the barriers that come along with those who have suffered mental illness. And another very important thing is that we need to have systems in place that enable us to have follow-up diagnosis and treatment. Like I mentioned, if you look at most of our government facilities, for example, you may not find some of these screening tools that we talked about. And if we have good systems that enable that diagnosis and eventually the treatment and also the follow-up of the patients, that will bring us, or that will enable the success in managing maternal mental health. So in conclusion, we are saying maternal mental health is very, very fundamental for us to achieve global health targets. We are talking about sustainable development goals, and goal number 3 is talking about achieving health for all. And health for all includes maternal mental health. Maternal mental health influences the women's caregiving abilities or capabilities, and therefore it impacts on the health of the children. Also the development, as we have seen. If a woman is mentally unstable, or if the woman is mentally ill, then they can be able to, they may not be able to take care of their children adequately. Addressing maternal mental health requires comprehensive and holistic models of care. And we have mentioned some of the ways, the collaborative ways, and even the community approaches that can be used to be able to reach out and be able to manage mental health illnesses. Access to simple, reliable, and affordable means of identification and management of mental health problems is a basic human right. This is what many of our people do not know, that it is their right for them to be able to access affordable, accessible, and simple, and also reliable, such that if they came today, they are seeking this service. they should be able to find it. And if they came back for it, they should be able to find it. That is reliability. And it should be affordable. It should not be too expensive. Addressing mental health needs of mothers, and particularly for mothers, has a positive implication for not only the women themselves, but their children and their families, and also the community and the society at large. So that means this one person, if we're able to manage this mother alone, then we can be able to have a ripple effect on eventually the children, the family, the society, and also the community at large. We recommend early detection of illness, as we have said. The early you detect, the better. We also recommend psychoeducational interventions. That is, we need to bring in information with psychological support, particularly for women who have psychological illnesses. We need to increase access to education for women and girls, because if women and girls have information, if they are empowered, they know about mental health, then if they notice that they have a problem, then they can easily seek care. And also for the reason that we mentioned, some of the risk factors include poverty. And if we empower women and girls, then they can be able to have that independence, and we will be able to tackle that risk factor. Improving mother-child interactions or mother-child relations, that is the bonding. And we realized how bonding is very, very important in development of the infant. We also need to promote gender inequality, so that we improve partner relations, and this will address the issues of gender-based violence. So if we are able to promote gender equality, helping the partners to have good relations, then we can be able to prevent mental illness. We need to have culturally sensitive solutions. Again, as we mentioned, sometimes in our cultures, different people have different perceptions of what mental illness is, and we need to have psychosocial support for women and girls. Finally, we say clinicians should be able to screen patients at least once during the perinatal period for depression, anxiety, and other symptoms of mental illness. Thank you very much. So back to you, Katile.
Thank you so much, our speaker, Dr. Jebet. I really learned a lot today on matters of maternal health, from the risk factors to some of the examples of maternal illness that one can get and how we can cope. So I really appreciate it, and I'm so amazed. And I think if anyone from the participants has a question, you can raise your hand or type in the chat box.
Allow me to recognize my colleague, Dr. Irene Magieto. She's in attendance. She's a mental health expert. Thank you.
That's wonderful. Do we have a question from the participants? Jacqueline Omar saying the session was so educative. Thank you for the good presentation. Jack Ma, thanks for the session. For the next session from the session was awesome. I think we have really understood the session. For me, it was a well understood. We really understood it. Okay. Thanks for the session. Josh is saying session, it was a great one. I think that we can use a thumbs up to show appreciation to the speaker. Valuable. Thumbs up. Thank you, Josh. The session is honestly, I really appreciate the speaker and back to you, Dr. Jebet, your parting shots. Thank you for your responses. I really appreciate. I can see them in the chat box. Daktari,
Yes, Katile.
you can give your parting shots.
Okay, so thank you very much for the invitation to this initiative. I really appreciate. And my parting shot regarding maternal mental illness is maternal mental health should be everyone's business. Thank you.
I really appreciate that. As you have had, maternal health is everyone's business, and we should take care for those. We should look out and help those who are maternal health issues. And with that, maybe I want to say thank you so much, Daktari, and we really appreciate for that wonderful session and introduction to maternal health. So with that on my side, I wish you everyone a good evening. And for those, I know some are following us in Facebook and we're not able to set up in Facebook. So we'll have the recordings in YouTube, then I will share everything. So thank you so much and have a good evening, everyone.
Good evening, bye-bye.
Good evening too. Bye.
Bye.